I've been at deliveries where what looked like a highly traumatic event with emergency circumstances ended up being something that a patient felt like they could process in real time and didn't experience as being traumatic at all. On the other hand, I've been in what looked like a textbook normal vaginal delivery where the patient felt terribly traumatized. What accounts for this difference? Coping mechanisms that we learn early in childhood carry us through our life. The typical responses of fight, flight, freeze, and fawn are all ways we learn how to deal with trauma. Trauma occurs when things are overwhelming and when there's not enough resources to deal and process with emotions as they're occurring in real time. The brain has a way of deflecting and putting that experience away on a shelf to deal with it for another day. Whether or not you choose to deal with it will determine if that trauma event continues to haunt you. And sometimes that stress comes out sideways and looks like irritability, anxiety, depression, and broken relationships. Let's take apart those four different coping mechanisms. Fight is what we see when people feel activated under stress. You might know somebody like this that gets really big and aggressive in response to stress. They might want to be highly vocal, raise their voice, or even throw something or get violent. This is the fight response. The flight response is wanting to run away. I've literally seen patients crawling up the bed trying to get away from the stress of having delivering a baby. It makes you want to run, and in times when you can't run, the mind still wants to run and find a place to hide. This is a response that feels like getting smaller. Similarly, freezing is when you have that look like deer in the headlights. This is when people just can't answer questions. They feel overwhelmed and confused by trying to verbalize any desires. Freezing might look complacent. It might look like passive. It might look cooperative. It's the response again of getting smaller in order to deal with the stress. The last coping mechanism, fawning, has been more recently added to the list of coping mechanisms, and it's about people pleasing. This is also a response of feeling smaller, but it can be very verbal. It can be very activated. It can be overly cooperative, overly pleasing, wanting to do everything perfectly. This is also a way to try to find some sense of control when there isn't a lot of control in the situation. Can you identify any of these coping mechanisms in your own behavior? Trauma occurs when there is a loss of control over your circumstances, combined with a fear for your well being or that of your loved ones, including the unborn baby. In that definition, we can so easily see how being admitted to the hospital and delivering a baby can be a perfect setup for a traumatic event. Feeling a loss of control on a hospital admission is pretty common. There are plenty of things that contribute to this, including taking off your own clothes, having to put on a patient gown, the connections to an IV or a monitor, the coming and going of people throughout the night and coming into the room doesn't feel like you have a lot of control at all, or getting a chance to eat or drink. All of these things help contribute to a mindset that feels like there's a lack of control. It's normal to feel scared when going to the hospital. It's a place that we associate with illness. And furthermore, it's an unfamiliar environment with a lot of strangers around you. And being there to give birth is a very vulnerable position to be in. So we can easily see how these two contributing factors are a setup for trauma and childbirth. Healing work can help you identify your coping mechanisms and interrupt the pattern of responses and knee-jerk reactions that you have to stressors. Unpacking the trauma of childbirth helps clear the slate for future births and can help improve your relationships with yourself, your family, and friends. This work is so important because it really can help shift the paradigm of birth in our culture. Enrolling in my program, you'll find community of people that are dedicated to growing past their traumatic childbirth experiences. In the one-to-one program, you'll get focused attention to help strategize on how to do the healing work and how to recognize when old patterns are arising. This is an alternative treatment to postpartum depression and anxiety that doesn't include medications. It's about finding validation and witness and support in your journey and finding community, knowing that you're not alone in these experiences. Follow the link in my description and fill out an application to join the program. I'd love to have you. You're not alone, and I'm here to help.